This is Focus on Your Health. It's brought to you by Kingman Regional Medical Center in historic Kingman, Arizona. I'm TG LaFredo, and this week I am on the road. I'm coming to you from Sedona, Arizona. I am at the 39th Annual Pediatrics in the Red Rocks Conference. My guest is Dr. Sean Elliott. He is a professor of pediatrics at the University of Arizona in Tucson, and he specializes in pediatrics infectious diseases. Dr. Elliott, welcome back.
Thank you much for having me. It's great to be back.
Thanks for coming back. You're a veteran of the show. We met up at this same conference 2 years ago.
Yes.
And we talked about what was going on in infectious diseases in Arizona at that time.
Uh-huh.
And you made us itch and scratch.
Not my intent, but I'm sorry.
That's what the study of infectious diseases is all about.
Yes, indeed. Yes.
So I don't know for sure, but are you going to pick up where you left off?
Well, I might. We have a couple new fun things to talk about, which people might have heard about also in the media.
Yeah, hot topics, important stuff that people should know about infectious diseases, particularly as pertaining to pediatrics?
Yes, pediatrics, of course, but this actually may be pertinent to adults as well.
Yeah.
Yes.
So, where do you want to jump in?
Well, probably the first and the foremost is what's very, very, very hot, and that would be Zika virus.
Right.
I think most people have heard about it, read about it, etc. For those of you that haven't, it is a virus that is carried by mosquitoes, and there are two mosquitoes specifically we need to know about: Aedes aegypti and Aedes albopictus, both of which are in Arizona and actually to the southern part of the entire United States of America. These mosquitoes carry not just Zika virus, but also dengue and chikungunya viruses, all of which can be quite dangerous to human health. However, the big thing about Zika virus is the experience out of Brazil very recently with babies being born with microcephaly. Microcephaly is very, very small head size, and it's frequently associated with brain regression, cognitive delay, problems thinking, seizures, and even fetal or baby demise. Babies are dying in utero with this virus.
Wow.
So prior to November of 2015, Zika virus existed. It's been around since, so far as we know, 1947. However, over the last 50 years or so, we're just sort of smoldering along, not doing a whole awful lot. 2007, a small outbreak in Micronesia. It really didn't achieve national significance until just this last year, end of last year, when not only were patients in Brazil being diagnosed with Zika virus, but there were 4,000 unexplainable cases of microcephaly, small head size, in brand new babies. And these babies were sick. They were doing very poorly.
Yeah.
So devastating. I think many people have maybe seen pictures of these patients. And the concern is that virus, if it is infecting a pregnant woman, can cause damage in utero, and there's nothing we can do about it. The virus itself does not cause very severe human illness for others. So some rash, some fevers, red eyes, and some swollen, painful joints. So things which you might sometimes get with just a routine viral illness, which you pick up during the wintertime. It lasts for 3 to maybe 7 days or so. Not significant, not major, unless you happen to be carrying a baby inside. And there is a huge risk, we think, but we don't know how high the risk is, for that baby to be infected in utero. So it's a concern, and it's a concern because it doesn't just exist in Brazil. There are cases all throughout Central and South America, and the mosquito and the virus have been demonstrated in parts of Mexico and imported by travel into the United States.
Right. Can you tell that the mother who's carrying, can you tell that she is infected?
Unfortunately, no. And here's the real scary part. 80%, 4 out of 5 infected humans do not have symptoms. They're asymptomatic.
Okay.
And yet they are still infected. If that is a asymptomatic but infected woman bearing a child, that baby still has risk of getting infected by Zika and has this unknown but likely high risk of getting microcephaly, seizures, brain growth problems, etc.
And there's no test that you can do on the pregnant mother?
Well, so there is actually.
Okay.
The problem is knowing whom to test,
okay.
Right? So they're asymptomatic, so how do you tell? Right now, the testing strategy through the Centers for Disease Control, the CDC, and in Arizona, the Arizona Department of Health Services, is to obtain a travel history. So returning travelers from a country in which we know there is active Zika virus deserves to be tested if they're pregnant. And therefore, they can be followed very closely. They'd be entered into a high-risk pregnancy category, ultrasounds of the baby, et cetera, and so forth, counseling given, you name it. It doesn't stop there, of course, because it is also possible for the infected man to acquire the virus and maybe be asymptomatic, but come back to stateside and then infect his partner.
Really?
Man or woman, that has been shown to be sexually transmissible. And if the woman is also pregnant, baby's at risk. So testing is also being offered in this particular case for a symptomatic man who has returned from a country of origin within the last 2 weeks.
So, but if you can get a positive diagnosis, is there anything you can do with that?
No, unfortunately. There's no treatment, although treatments and vaccines are being worked on, in a furious rate right now, of course. But there, as of right now, is nothing one can do about it. So that's what I mean about counseling. We don't know the risk to the baby, but it's not zero. Yeah. And if the pregnancy is affected in the very early stages, indeed, people are talking about termination of pregnancy. That, of course, brings up a whole huge range of other issues. Yeah. So it's a big problem. So what can we really do about this in general? Well, prevention. And that, I think, is where perhaps the meat of this story should go. And that is, if one is a male or even female, man or woman traveler to a country which is known to have Zika, for example, going to the Summer Olympics in Brazil, take plenty of protection against mosquitoes. Soak those clothes in permethrin. You can get that from the camping stores. Apply DEET or mosquito repellent to yourself. It's safe. It's okay. Sleep indoors at night under mosquito netting. Just make sure you don't get those mosquito bites. And here in the States, because, again, the mosquito is here, and we so far have not had local transmission, meaning a mosquito biting an infected person in the States and transferring it to a second person, but that is going to happen. So what can we do now? Mosquito abatement. So get rid of standing water, indoors, outdoors. Make sure you don't have areas where mosquitoes can breed.
So this may sound like kind of a dumb question, but that's my job. And
I'm all about dumb questions.
Okay,
Bring
well,
it on.
I grew up in the Northeast, and in the summertime you step outside and they're swarming. Mosquitoes are everywhere, right?
Yes.
If you don't know the desert very well, you say, well, how many mosquitoes do we really have? How much water do we have, for that matter?
Right.
To what extent do we have a mosquito problem that we need to worry about this?
Unfortunately, a lot more than people realize, for exactly the reasons you just mentioned. It's the desert. It's arid. We don't have water here. Well, we do. There are some who still water lawns. There are potted plants outside, and the little water retention cups underneath can retain just a little water. The Aedes mosquito, both the Aegypti and the albopictus, are called floodplain mosquitoes. So they lay their larvae perhaps the season before. Things dry out, that's okay. As soon as you get a monsoon storm, a little sprinkle of rain, a garden hose, whatever, they can reactivate and turn into a live mosquito. So yes, we have a mosquito problem even in arid Arizona.
These are the survivors of mosquitoes.
Yes, they are. They're out there.
They're the operatives.
Yes, they are. Yes, they are. So and again, Zika virus is probably the biggest concern right now. The situation will get worse, guaranteed. Yeah. Over 300 women in the United States and Puerto Rico are known to be infected and carrying a baby. They're being tracked so far. That number will escalate significantly. Yes, we'll have local transmission. Yes, the disease itself isn't severe, but the impact on babies is. But it's not just Zika virus. There's also dengue and chikungunya.
Oh, go ahead.
Right, okay.
Please do.
So those are also carried by the same mosquito vectors. And these viruses, or these infections, dengue, chikungunya, are almost, not identical, but very similar in presentation. Some have heard them called break-bone fever. Others, bending disease, because they cause severe muscle cramps and joint cramps, which are so severe that people cannot walk. In fact, some swear they hurt so badly their bones are breaking inside them. Wow. That's not pleasant, of course, and it lasts for about a week or so. In the case of chikungunya, though, it can last and recur over 6 more months. So it's actually a crippling illness, which, again, we've seen only limited amounts of in the United States, Florida, and now Texas. Dengue does exist. We have had cases in the United States, but it's right across the border, even into Sonora, Mexico. So there's a risk there as well. That illness is potentially dangerous. There are hemorrhagic forms where the patient gets reinfected and they can develop shock, multi-organ failure, bleeding out, etc. Wow. But most people experience about a week of fever, horrible cramps of bones, well, not bones, but of muscles and joints, and various other features. And it's a miserable disease to have. No treatment for that either.
How am I going to avoid getting that?
Don't get bit by a mosquito.
Yeah.
That's as easy as that.
Same thing, right?
Yeah,
Just
exactly.
all about staying away from the mosquitoes and
Right, exactly. So, and now there are some of us who are blessed to be not all that attracted to mosquitoes. There are others, like my wife is a mosquito magnet. So I can be outside, no protection at all, and they all go zooming for her.
You just travel with her, and that way.
That's my life plan. I like that.
All right, so bad news about mosquitoes.
Unfortunately so,
Yeah.
right? But good news in that we can avoid mosquitoes, again, by being careful about mosquito precautions, abatement procedures, etc.
Okay.
It also hopefully is reassuring that the state health department is very, very active and proactive in all of these interventions. So we are not alone. It's not like there's nobody looking out for us.
Right.
There are dollars, actually millions of dollars being funneled from CDC into state health departments to help us in this activity.
It's time for a quick break on Focus on Your Health. We'll be back in a moment for more from Sedona with Dr. Sean Elliott. Stick around.
Grill in my backyard barbecue, trying off the shake of a stressful day. Pull off the top from a homemade, homebrew, custom-made IPA. The sun is falling at the angle where the mountains turn to shade. Look all round at all that beauty, and I know we've got it made. Smoke rising from the grill with a smell sweeter than the trees. Pull out my old six string, pull out an old melody, and start singing an old song from the Allman Brothers Band. Swing about sweet Melissa, and my friends give me a hand. No, it don't mean much to anyone but me, but with my friends sitting round, it ain't nothing too profound. Feels like home to me. Well, it feels like home to me. Sitting on around that table with more food than can be eaten. Life's waving in reverse, a pattern playing on my mind today.
And welcome back to Focus on Your Health. I'm TG LaFredo, and this week I'm coming to you from the road. I'm in Sedona for the 39th Annual Pediatrics in the Red Rocks Conference. My guest is Dr. Sean Elliott. He's a professor of pediatrics at the University of Arizona in Tucson, and he specializes in pediatrics infectious diseases. All right, so that's the truth about mosquitoes.
There you go, fun and games. But it doesn't stop there. There's always something more to talk
All
about.
right, let's talk about something else.
Okay, all
something
right.
else that I can worry about.
Okay, just because I'm
possible.
all about that. Okay, so let me ask you this. Have you had your measles vaccine?
I have.
Okay,
yes.
Fantastic. All right. So right now today, we have a new measles outbreak in Arizona. We just got over one in 2015 related to the Disneyland exposures. I'm sure everybody remembers those as well.
Yeah.
Well, we are live once again. Today we have 14 active cases centered around Pinal County. And it's, again, an unvaccinated person who then infected others around that person. And unfortunately, some of the secondary contacts, those who are infected by the initial or index contact, were indeed vaccinated, which is fantastic. So they're having what's called modified or variant measles. Mm-hmm. It's much more mild, nowhere near as dangerous. So the vaccine is still very effective, but it's not able to necessarily prevent disease if one was vaccinated early as a child. So that's all fine and dandy, except that those variant measles patients were not so sick as to avoid going out to public areas. for example, the Achin Harrah's casino for 7 hours and infecting, or exposing, I should say, well over 1,000 people. So the contact investigation continues. We have not seen anywhere near the end of this particular cluster. So vaccination strategy, very important. Pinal County is on what's called an accelerated vaccine strategy. Infants who are younger than the typical time to vaccine, which is 12 to 15 months, are now being vaccinated at 6 months of age.
Right.
And it's all an attempt to protect everybody as rapidly as possible against what is likely circulating measles.
And these are the same measures we had in place when the Disneyland outbreak was going on. Is that right?
Correct. Same response. Yeah. So when cases that acquired measles in Disneyland came back to Arizona, and again, many states, not just Arizona, they themselves were investigated, and we did what's called a ring vaccination strategy. So their contacts were all vaccinated as well. And for a time, Maricopa County was under the accelerated vaccine strategy as well. So it's all a matter of trying to stop the outbreak before it even gets started.
Yeah.
Right now, it's unclear which way it's going to go. There are definitely plenty of contacts, but the number of cases, the tempo in which this is increasing is still pretty low.
Can we talk about vaccines for a moment?
Sure,
well,
absolutely.
Imagine this is a topic near and dear to your heart.
Oh, boy, yes.
I think maybe it's been 2 years now. I was talking with Will Humble, who's the director of the, help me out,
well, at the time, he was the director of the Arizona Department of Health Services.
There you go, that's the right term.
He has now gone on to the College of Public Health through the University of Arizona and is doing incredibly great work there as well.
Okay, so he's down there. He's your homie.
Yes,
yeah?
Exactly.
All right, he was directing the Department of Public Health at that point.
Correct, yes.
And so I talked to him, and we were talking about statistics about vaccination. And today you and I are talking in Sedona, and at that point he was saying Sedona in that area is ripe for a major problem.
Yes.
And he went on to say, in general, Southern Arizona looks good. Native America looks really good. Sedona... And so I was like, I get there's this sort of enlightened culture, too smart for... that seems to be the subtext.
Well, there are many descriptors, the anti-vaxxers, those whose faith systems or belief systems tell them not to vaccinate themselves or their children.
Yeah.
This is a very, very challenging worldwide problem, actually. And again, it's a science versus faith argument, and we're never going to resolve this, unfortunately. But yet still, what I encourage everybody to do is to assess the science and talk to a believable source. That does not mean to go online to some of the anti-vax websites, because there's no true science behind there.
But you're part of the machine.
Of course I'm part of the machine.
And that's why you would say that, because you're turning us away
right.
from the truth.
Right.
And this is the whole problem, right?
That's exactly right. So that's how these conversations go. Yeah. So what I'm not here to say is like, you must vaccinate or else you're dead, et cetera. What I'm saying is, look at the science, try and find a source which you think is believable, and have a conversation. Yeah. And so when I encounter these in my practice, so pediatric infectious diseases, I will sometimes get families referred to me to have that conversation. Yeah. And what I will do is have a reasonable, look, here is the evidence, here's the science. I know the immediate reaction is to think this is completely biased. This is, the man or the government or whatever. But many, many, many of these science projects and research areas are coming from well-balanced, carefully conducted science. And the intent is not to vaccinate everybody needlessly, but to try and affect public safety. Yeah. Think of it also from the societal perspective. Once you drop below 80% vaccination of a specific type of vaccine, one is far less likely to maintain herd immunity, which means that some people who cannot be immunized, reactions for allergies or the immunocompromised, means that they are now going to be exposed and at risk for these very dangerous, deadly diseases. And that's the problem. People forgotten. So people forget that you can die a horrible death from seizures from measles. You can die from horrible meningitis. You can die completely starved, suffocating for air from pertussis. I mean, these are vaccine-preventable infections, and yet we are now exposing our most at-risk patients to these. It just doesn't make sense.
Yeah, and I remember an interview I did with a physician who is from India, who trained there, talked about doing his internship in this hospital where, kids were in iron lungs, they're dying of polio, they're crippled, they're, they're in and they're not going out.
Yeah, absolutely. So very debilitating, and just the sheer frustration is one can see a new claim which is like, measles causes blah blah, or I should say measles vaccine causes blah blah.
Yeah, MMR.
Followed, right, exactly, and this played out in the United Kingdom, and what kills me is that Andrew Wakefield, who's the physician who started this whole measles vaccine autism thing, completely falsified his data. I mean, that's fact.
And has since been disbarred.
He's been disbarred, and no, that wasn't punitive. That was, the College of Science in London, for Pete's sake. And he was legally accused of falsification. I mean, this is not the medical scientific community saying, let's get this
guy.
There's
some evil cabal.
Right, exactly. And so, and yet still the damage done by his falsified data stands today. And again, I'm very familiar with the scientific evidence, but I also, again, continue to encounter new concerns and or claims of concern, and it's legitimate to have those conversations, but it's not legitimate to close your mind to both sides of the argument. What I would hope is that science and reason can win the upper hand, and allow people to realize the need to vaccinate.
Knowing human beings the way I do, I'm sure science and reason will win out.
Oh boy, let's talk about more infections.
All right, let's do that.
Oh my goodness. I think that the last one, and this is just just for your information, and it's actually truly not a major risk to human health, but this has to do with migratory cliff swallows. All right, so in America, we have many migratory birds, which is fantastic. This specific bird is the one that creates the mud nests, typically under cement overhangs.
Okay.
We have them outside several of our hospitals, and they are protected by federal law, which is appropriate.
Okay.
The problem is that these cliff swallows happen to carry a soft tick, the Argas tick, which, if it gets inside a domicile, a house, or a hospital room and bites a human being, can cause quite the allergic reaction. So we're talking hives, we're talking swelling of the face, of the arm, and stuff. So there you go, just to leave you with the itchy and the scratchy.
In 4 different places right now, and I didn't think that was possible.
Exactly. So, and I'm sorry to say that the American cliff swallow, nests in many parts of this country. It certainly does in Arizona, and already is in the middle of its nesting season as we speak. So, it's
what am I going to do about this one?
Well, you're going to hopefully prevent nesting in the first place. Now, once the birds are actually nesting, i.e. they've got the eggs laid in the nest, they're protected by federal law. You cannot knock down the nest, and that's illegal, and that's inappropriate. But if you see the nest being built, it is okay to spray it down with a garden hose. Yes, right. And just try and discourage them from nesting in your house, which means to go to your neighbors, and tough luck for that person. So hopefully they heard the show also.
I think that was an episode of The Twilight Zone, wasn't it?
It may well be, exactly. So there you go. So fun and games. However, even though if these soft ticks enter, they're not aggressive. They won't come seeking you out. They're just looking for a blood meal, which typically comes from the birds. And if we get a bite, it's unlikely there'll be a major reaction. But it's just one of those things. Just FYI.
Have we seen problems with this in humans?
Yes. Yeah. There are definitely reports. And in some hospitals where you have patients who are unable to move or escape, they're unfortunately a target, a victim. So we may have the unexplained allergic reaction, like, where did that come from? Bad mosquito bite? Is it Zika virus? No. That's it. It's actually maybe a soft tick associated disease. Nice.
There we go. It is the fastest radio show I do all season, and I hope we can do it again next year.
Definitely. We look forward to it.
Dr. Sean Elliott, thank you so much.
Thank you also. Have a great day.
Well done, sir.
Awesome. Thank you.
Easy.
Feel the warmth of light, sails of dust suspended, the backdrop of warmth and light, vision of a shadow.
And that's the show. That's Focus on Your Health. I'm TG LaFredo. Thanks so much for listening. If you'd like to write to me, you can send me an email at foyhradio@gmail.com. That's Focus on Your Health. foyhradio@gmail.com. We'll catch you next week.
Radiant heat around, my ideal of life. This western saunter.
It's those dad burn mosquitoes.